Mr. Reid and your team, I appreciate you coming to us again today. I suppose if I take you back to the first days in March when there was an outbreak in my own constituency in a local school, I think some of the communications around that, some of the very early stages, were possible because there was a small number of incidents. Given with the reopening of schools that are taking place, I wonder if the HSE has looked at the communication strategy for what will happen when an outbreak takes place, as it inevitably will in a school. From my own experience, there was a lot of confusion, particularly because of social media, because the information was able to travel so quickly. And in the absence of any statutory decisions on what would happen, all sorts of confusion took place. So I'm talking about, if an outbreak takes place in a school, do all those children have to isolate? Do brothers and siblings, brothers and sisters have to isolate? If you're in a local soccer group or a Gaelic group, do you have to isolate? And I just wonder if we can be really clear, because I feel a strong communication strategy is really necessary alongside the public health strategy.
Hey, Deputy, I'll just answer two parts. I might ask my colleague, Dr. Colm Henry, to comment as well. Just on the first instance, as you quite rightly said, as it emerged back in February, March, and the country was scared, and thank yourself and other local elected representatives for support during that process. We did go out publicly ourselves in the HSE, and we met with the teams in the school. We met with the parents across the schools. You are quite right. How could you manage that situation if we have potential numbers of schools with cases or potential outbreaks next few weeks? I think the first thing to say is that we should plan on the basis there will be positive cases. Plan on the basis that there will be likely outbreaks across the country in different schools. That's most likely the scenario that we have to work towards. And that's the scenario we've been working with the Department of Education on. And we've been giving them clear guidance in terms of their role in terms of communicating out with parents, and also our role, which is primarily led by our public health teams. I just make a brief comment because Dr. Henry covered a bit of this earlier on. I know people would look, would kind of have an urge to have a kind of checkbox, what happens if, and you tick the following boxes. But our public health teams largely go in and assess each individual school, in this case, organisation, on its individual drivers and the transmission of the virus and a various number of factors. And so the primary driver of the communications will be through local public health teams in conjunction with the Department of Education and the local schools in how they communicate out to patients. But we have to, or out to their parents. But the public health approach is, exactly as Dr. Colm Henry said it, a range of factors: the numbers of cases, the rapid spread of cases, the impacts of the cases in terms of hospitalisations, what's happening in the community, what's the responsiveness of the local management of the school, how do we get reassurance of what measures we're taking are having an effect. And all of that is geared towards not getting to a scenario of shutdowns across the place. So there's a range of processes, public health led by our public health experts, that we will be driving, but communications from the Department of Education and local schools directly with parents. Okay.
Just briefly, Deputy, just to reiterate, it's unrealistic to expect we can eradicate risks. We can't. I recall that meeting at the beginning of March when we communicated that clearly. Viral and upper respiratory tract symptoms are very common in primary school children. Vast majority are due to more common ailments, and clearly in communicating this, both to parents, to principals, to teachers, to wider society, we're trying to strike a balance between the huge health and well-being benefits for children in education, the opportunities this presents to health in terms of vaccines, screening for vision, for hearing and so on, versus the risk of transmission of the virus. And as I said earlier, the emerging evidence is that child-to-child transmission in the school setting occurs at a lower frequency and is rarer than we thought initially. So what we have to have in place is a clear communication to GPs, a clear definition of case insofar as we can when one considers all the other illnesses children get at this time of the year, and then a rapid testing strategy for those who are funnelled through to testing as determined by a general practitioner. And as I said, we've been working with primary care this week and with public health in an algorithm for this purpose.
Thanks, Deputy. Thanks, Dr. Henry, and thanks, Deputy McAuliffe. The next speaker